5 to 10% of youth in any community or school will have serious and complex behavioral health needs. In order to thrive in their homes, schools, and communities, these youth need all the adults in their lives, including professionals, family members, and natural supports, to work well together to meet their many needs. For children and youth, the most common method of coordinating services and supports is called the wraparound process. Over the last 25 years, Wraparound has become the most common and best researched care coordination model used by state and local systems of care. During the same time period, another important movement has also shaped the field, the evidence-based practice movement. So, what is the relationship of wraparound to evidence-based practices, or EBPs? Some have suggested that wraparound and EBPs are from two distinct schools of thought, independent of one another. This, however, is far from true. In fact, wraparound and EBPs should coexist in a system of care. What's more, they complement one another in a number of important ways. First, the elements of high-quality wraparound are based on research evidence for what works. Engagement strategies, high-quality teamwork, shared goals, and progress monitoring are all part of high-fidelity wraparounds. They are also all common factors of evidence-based practice. Second, high-quality wraparound and systems of care both demand that evidence-based treatments are available in the service system. Just as youth should receive medical treatment that is proven effective, youth enrolled in wraparound and their families should have access to treatments that are known to work for mental health problems, such as behavior issues, trauma, anxiety, attention problems, and depression. Third, wraparound care coordinators must be trained and supervised to be fluent in evidence-based treatments and how they can help meet family needs. Care coordinators must also know what community providers use EBPs, so they can connect families and teams to them when needed. Family and youth peer support partners should also have relevant training on EBP, so they can explain these treatments, answer youth and families' questions, and provide follow-up support to their implementation in families' homes, schools, and the community. Finally, the hallmark of evidence-based practice is research. Wraparound has been the focus of over 100 research studies, including 20 controlled outcome studies. The vast majority of these found positive effects of wraparound. As for many EBPs, research has also shown that wraparound implementation quality is critical to achieving outcomes. Wraparound and EBPs are related to one another in a number of important ways. Both concepts should be incorporated in systems of care. Remember, effective services must be available for wraparound teamwork to be effective. Wraparound staff must be trained to understand and use evidence-based practices, and wraparound itself, when implemented fully, is evidence-based. Learn more about wraparound and evidence-based practices in the related resources on this page.